Malachi, well, health officials are urging us all to wear masks, stay 6 feet apart. They put out that message yesterday to stop the spread of COVID-19. Our medical expert, Dr. Cedrek McFadden, is here to talk about asymptomatic transmission of the virus, which I guess is part of the reason they're asking us to wear masks.
Yes, because that's part of the confusion. When someone's asymptomatic, it means that they will not develop any symptoms from COVID-19. Now, this is very different from people who are pre-symptomatic.
Okay.
That means people who are infected but just haven't begun having those symptoms yet, perhaps days or go by. The challenging part about it is in the 2 or 3 days before you develop symptoms, you can still transmit this virus. And so you can still be spreading the virus, and you can still, and this explains kind of why we've seen such an efficient spread across the world in such a short amount of time.
So let's talk about explaining the World Health Organization statement, because they put something out this week saying we don't think that the asymptomatic spread is as common as we first thought.
Yeah, so initially they came out doing a press conference on Monday, and it was confusing to a lot of people. They came out, and one of the lead investigators said that it is unlikely. It is unlikely that it will spread this way. And this was really sparking a lot of conversation because it was based on very few studies, perhaps some questionable studies. And so they came back out the next day and said, well, it's not widespread. And so they changed that language a little bit just to reflect the fact that we don't really know how common this could be.
So we do have to protect against it, in other words.
We have to protect against it, and we have to recognize that, perhaps, the numbers go anywhere from 6 to 41%, which is an odd range, but 41% of people won't have symptoms from COVID-19.
Wow.
Now, how do we know that? I mean, first of all, most people who aren't really feeling well are not getting tests, meaning if you're feeling perfect, there's no reason to think you need to have a test. So they're finding these from people who are perhaps in nursing homes, on cruises, or perhaps in prisons where they just happen to give a test and find out that it's indeed positive.
We had a viewer who actually emailed in today asking, so if I don't have any symptoms, should I get tested since there's so much potential for asymptomatic spread?
So the people that are studying the spread, and certainly this particular topic, they'd say yes, definitely get tested. But for the average person, they're not thinking of getting tested during that time period. But you can still spread it by talking, singing, even panting during exercise.
And so those are the ways it happens, right?
Yes, just through common contact with people.
So what is the big picture message when it comes to asymptomatic transmission? What do we need to be doing? What do we need to be thinking about?
So we still need to be wearing those masks because of this reason. One particular study said 45% of the cases can be related to these asymptomatic carriers. And so we still have to assume that we all have it. And we all have to still be protective of each other, wearing the mask, cleaning our hands, and maintaining that social distance and avoiding large group gatherings.
Well, there is a Facebook post right now on WSPA's Facebook page where you can add medical questions, if you have any right now, to the list, and we're going to tackle those on Facebook Live on the WSPA page coming up during the 5 o'clock news. So make sure you join us online. You can have your phone over here and the TV over there and have a good time. Thank you, Dr. C. You're watching Carolina's Family at 4. We're coming right back.